Good evening. My name is Dr. David Doman, and welcome to another edition of Housecall. What is chiropractic? Is it the right treatment for you? Find out right now. My guest this evening is my daughter, Dr. Sandy Doman. Sandy is here not just because of our relationship, but she has a very distinguished background in chiropractic. Sandy, welcome to Housecall.
Thanks for having me.
My pleasure. Now briefly, tell our viewers about your unique background in chiropractic.
So my undergraduate education is from Lehigh University in Pennsylvania. And then I went on to pursue my doctorate, which is a doctorate in chiropractic at Palmer College of Chiropractic in Florida. I went on to move to Miami, Florida, where in 2010 I opened Miami Sports Chiropractic and Yoga Center, which is an integrated natural health care facility. I then went to serve as the 3-year president of the Dade County Chiropractic Society, and now I'm on the board of directors for the Florida Chiropractic Association.
For the entire state?
Correct.
Wow. And then we'll talk about some of your other exciting activities in sports chiropractic later during the interview.
Absolutely.
So let's start out at the top of the show with defining and explaining to our viewers, what exactly is chiropractic?
Chiropractic is a healthcare profession that focuses on disorders of the musculoskeletal system, the nervous system, and the effects of these disorders on the overall health of the body.
And who first was the founding father of chiropractic?
So the founding father of chiropractic was a man named D.D. Palmer, and that was in 1895. It's important to understand that chiropractic, it's a combination of 2 Greek words, chiro, which is hand, and practic, which is done by, so it's done by hand. And the manual work and healing of hands-on has been for thousands of years, but it's D.D. Palmer who created the system, the art, science, and philosophy of chiropractic, which is what we practice today.
Very nice. So what exactly is the rationale for chiropractic? What was the art and the science that D.D. Palmer advocated?
So what D.D. Palmer advocated is that the spine is truly a pathway to the overall health of the body, and that there is a vital communication between the brain and the nerves to the functioning of the overall system, and that by treating the spine, that we can not only reduce pain, but also reduce stress on the body and create healthier, more vital people. And
this has now been progressively embraced now for well over 100 years, and clearly is becoming more and more popular nationally and even internationally. Am I correct that chiropractic is available globally?
Absolutely. The countries I can think of right off the top of my head would include Canada, Mexico, Great Britain, Australia, Japan, Brazil. These are probably the most common places that you'll find chiropractic.
And is chiropractic practiced in Britain similar or different than the USA?
Extremely similar.
Okay. So let's say I'm a patient with low back pain, one of the more common reasons to go to the chiropractor, and explain to our viewers what is entailed with an initial encounter at your center.
Absolutely. So a chiropractor is a primary care limited physician, which means that we are a direct portal of entry between the patient and getting a diagnosis and then treatment. So a patient comes into the office and we take a complete history and find out anything from generational health issues to lifestyle to any number of issues that are getting them to come into the office that day, typically pain. And then the most important part that's going to differentiate a chiropractor from somebody else who treats back pain other than a medical physician is that we're trained to identify red flags, which are any sort of disorders that may cause a medical referral. So they're going to come in, we're going to have an examination, a chiropractic, orthopedic, and neurological examination, labs if necessary, X-rays, MRI, CT, whatever is necessary for the patient, after which the chiropractor will determine what the appropriate course of treatment will be.
And at your center, of course, you offer chiropractic, but what other treatment options are available at your specific center?
So at my center, we have chiropractic, physical therapy, acupuncture, trigger point, cupping, nutrition, yoga therapy, Pilates rehab, and a special type of posture corrective exercise called foundation training.
So then how do you, if somebody has back pain, how do you decide which of these treatment modalities is the best one for that patient in front of you?
So a big piece of it, I will always have some version of chiropractic at the center of a treatment plan because improving the structure and function of the patient is always number one when it comes to treating back pain. From there, I use a series of examinations as well as questionnaires to determine the pain level, the patient's age, which will also determine how I'm going to decide which therapies that they're going to go into. And I personally find that patient preference is one of the most important determining factors of whether or not they're going to follow through with the care and if it's something that's going to be successful for them in the long term.
And I, of course, have experienced chiropractic not only at your center, but locally here in Montgomery County. And each time I've also experienced electrical stimulation, ultrasound. Explain to our viewers how that is incorporated into what you do as a chiropractor.
So initially, when a patient comes in with acute pain, we do have passive care modalities, the ones that you mentioned, which are electric stim or ultrasound. I personally have gone the way of other natural healing type therapies such as acupuncture and cupping, certain types of manual therapies that I use in physical therapy. And these are different types of modalities that help to decrease pain inflammation, increase the speed of healing time, and support what we do as chiropractors so that the chiropractic adjustment is more effective and people get even better outcomes.
So you think these are all complementary modalities?
Absolutely, absolutely. When it comes to integrating any sort of natural therapies, it's important that when you meet an individual patient that you're able to customize a treatment plan based on their needs.
Now, of course, all insurance companies vary, and Medicare varies, et cetera, but generally speaking, nationally, is chiropractic covered by most insurance companies?
Absolutely.
All right. And is it covered by Medicare?
Absolutely.
Okay. All right. And then is this something where patients can refer themselves for evaluation and treatment, or do they require a referral from their primary care physician?
Right. So while a chiropractor is a primary care limited physician, we do have direct access. And so patients can come directly to a chiropractor. You do not need a referral, but each individual insurance plan is different. So it's important that you check with your plan first.
Now, something we've talked about, which is I find very interesting, is that there is within the field of chiropractic a diversity of opinion.
Yes.
And some of it, my sense is that it's almost distinguished by the different generations of chiropractors, that older chiropractors have a different view of evaluation and treatment compared to a younger chiropractor like you. Mm-hmm. So explain to our viewers what some of these difference of opinions may include.
You know, it's something I actually think about quite a bit, because when I think about the generational chiropractors, the ones who preceded me, I think of people who really had to pave the way for the work and treatment that I'm able to do today. And so their primary modality typically is a standalone chiropractic adjustment because it has helped so many people. I find that what they're doing in chiropractic schools today is teaching us how to manage a very holistic plan regarding health and lifestyle nutrition that helps to support the adjustment, and not just getting somebody out of pain, but keeping them well. So I would say that we're probably trending in the same way that medicine is with older physicians versus younger physicians, in that a lot of the young physicians that I work with are very lifestyle heavy, very heavy into integrating natural therapies. And so I would say that it's probably pretty similar.
Yeah. And my sense, speaking to my physician colleagues, is a lot of this is driven not only by their own sincere desire to have a open mind and a holistic approach, but a lot of it, frankly, is demanded by their patients.
That's absolutely correct. So there's two people pressing on medical physicians now with regards to the management of spine pain. Number one, the insurance companies, and number two, their patients. So I think this is probably an opinion shared by lots of us who work in natural healing therapies, is that there's a time and place for medicine, which is important to go to a medical physician for that type of consultation. But when it comes to diseases and pains of lifestyle, this is what patients want. Patients and insurance companies are now demanding something safer and more effective, and that's where chiropractic excels.
There's something we have talked about previously is, once again, this generational divide within the chiropractic community. And part of it is if somebody comes in with back pain and they're successfully treated, there seems to be a diversity of opinion about what is the next step, whether at that point, if they've been mastered lifestyle changes, whether they can terminate the care or whether they need periodic follow-up chiropractic adjustments. What is your sense of this controversy?
Less of a controversy and more of philosophical differences. So specifically in the United States, when we go see a doctor, it's because of pain and disease, and then there's a treatment, and then the relationship is essentially terminated unless you come for, a wellness exam or a screening the following year. Chiropractic is very unique in that it not only treats pain, but it can also help keep people well. And so depending on the lifestyle of the person, a 21-year-old, healthy, athletic, low-stress person with their first onset of low back pain probably doesn't need as much therapy or ongoing therapy as somebody who is maybe 80 years old and is a former smoker and potentially a diabetic and is somewhat sedentary. That person might need some more ongoing care. And so what I like to do with patients is I like to find out what their goal is. And I'm very straight with them literally on day one. What's your goal? Would you like to get out of pain or would you like to learn how to stay well? And so from there, we determine whether it's going to be a very short course of care, a handful of visits, or if they want to do an initial short course of care, no different than antibiotics, for example, where it's a short course of care, they get better. And then they determine if they want to return on a semi-infrequent basis. So for example, if they went back to a medical physician, it would be on a quarterly basis to check their blood pressure and see how they're doing and to do partnership-style coaching with regards to health and lifestyle.
And I would imagine sometimes you mix and match, where maybe you start out with chiropractic and maybe you transition them to other options within your center, like yoga or something like that.
Yeah, and this is why I brought all of these extremely talented doctors and therapists into my practice, which is not just to treat pain, but really teach the patient how to keep themselves well through all of these complementary modalities. Something I love to chat about with my colleagues in medicine is to stand around and pat ourselves on the back on who's the best at getting somebody out of pain is truly the low-hanging fruit of healthcare.
Right.
The real goal is, okay, we got somebody out of pain and it was safe and they're well, but how do we help keep them well generationally over a long period of time? And this is where I think that we all operate very well under one roof together.
How interesting. Now, we're going to pause briefly for a public service announcement. When we return, more with Dr. Sandy Doman and whether chiropractic therapy is right for you. We'll be right back.
Maybe you can make retirement happen. After all, you made home ownership happen. Homeschooling yourself on loans, beefing up your credit score.
So I'm pre-approved.
You were like, yes! Sorry. Color-coding listings, ticking boxes, and flushing every toilet in a 20-mile radius. Home sweet home. You aced house hunting. Now get the tips you need to get on track at aceyourretirement.org.
We just finished dinner and it was time for homework. He hates homework. I know he's bright.
Why is it so hard for me?
He's
I'm
just
trying
gotta
as
try a
hard
little
as
harder.
I can.
1 in 5 children struggle with learning and attention issues. Go from misunderstanding to understood.org.
We're back. My guest this evening is Dr. Sandy Doman, and we're discussing chiropractic therapy and whether it's right for you. Sandy, before we pause for the break, we really set the stage for discussing chiropractic, the science, the field, for our viewers. Now let's go into some specific aspects of the therapy you provide. Briefly, explain to our viewers how you view chiropractic actually provides benefit. How does it work?
So on the most traditional level, when a patient comes to see a chiropractor, they usually come because they have pain in their neck or low back, or they have headaches. And so a chiropractor is expertly trained in identifying areas of the spine that have fixations. And so if they feel a joint that is hypomobile, has lost mobility, it's not moving well, they can apply a controlled force either with their hand or with an instrument to increase movement back in that joint, which helps to decrease pain, decrease inflammation, improve mobility, and get patients well again.
And for many years, for decades, as you know, chiropractic was somewhat controversial. What is the current view of chiropractic with the National Institute of Health and indeed organized medicine?
So happily, the new low back pain guidelines have come out that are created by the American College of Physicians. It was published in the Annals of Internal Medicine. And this is considered to be the first line of treatment. So when you see your medical physician for spine pain, specifically low back pain, they are now supposed to recommend spinal manipulation, superficial heat, acupuncture, yoga as the first line of treatment for acute or subacute low back pain. So I would say that it is not only accepted by traditional medicine now in the United States, but it is incumbent on a medical physician to now recommend these things before medication.
Now, you mentioned prior medical therapies. I'll throw out a couple for you. For example, anti-inflammatory pills like Motrin, Aleve, etc. What are the pluses and minuses of using that to treat back pain?
As opposed to like NSAIDs?
Well, NSAIDs, yeah.
So NSAIDs are extremely dangerous. In fact, that somebody who takes NSAIDs for spine pain is 3 times more likely to develop a bleeding GI ulcer, as you are well aware.
Yeah.
And I think that number rises to 6 times more likely over the age of 60. And so the alternatives, NSAIDs and acetaminophen, which is shown to not even be effective, not even more than a placebo for spine pain. And then even worse, everyone knows that we are in the middle of a national opioid crisis. And so it's not a question of which works faster or what you're getting from your medical physician, but which works well and is the safest. And the research points to chiropractic as being dramatically safer than all of these medicine-based therapies.
So to a certain extent, to rephrase what you just said about the opioid crisis, many patients with back pain could avoid needing pain medicine with narcotics if instead they had a chiropractic series of adjustments.
Well, a chiropractic series of adjustments, as well as partnering with the chiropractor to become educated on what we call the chiropractic lifestyle, which is assessing and removing physical, chemical, and emotional stress that makes people unwell.
Right.
So we, treat the spine and use that as a gateway to returning proper structure and function to the body. But we all know that people these days are not eating well. They're extremely sedentary and their emotional stress levels are high. So while the chiropractic adjustment is our primary modality, partnering with a chiropractor as a mainstream physician in your life will also give you access to this type of health and lifestyle coaching.
Very good. So we mentioned low back pain. What are some of the other areas, complaints of patients that you address frequently with chiropractic manipulation?
So, as you mentioned, the most common disorders that present in my office are all different types of back pain. This could be from a low back spasm or arthritis, stenosis, herniated discs. These are probably sciatica. These are probably the most common things that come in. Any types of neck pain and all different types of headaches. Someone like myself who works a lot with physical therapy and sports injuries, I also do all orthopedic injuries of the arms and legs.
Okay. So if somebody has a hamstring pull, for example, or shoulder injury, that's something you would also address?
Absolutely.
Now, you mentioned headaches. How does chiropractic manipulation help headaches?
So it depends on what type of headache the patient is presenting with. I always say that there's all different flavors of headaches. So the treatment has to match the patient and how they're presenting. There's all different types. There are tension type, there's medicine withdrawal headaches, there are migraines, there's cluster headaches, and there's all different types. So if it's something that is usually a tension type headache, by removing pressure off of the joints and increasing mobility, you can also reduce muscle tension spasms and give the patient a lot of relief.
Now, one thing I thought would be so interesting for our viewers was the fact that you not only have a distinguished background in chiropractic, but in particular sports chiropractic. Tell our viewers about your role with Gulfstream Racecourse with horse racing.
So one of the premier horse racing venues in the whole country is located right outside of Miami, Florida, right near my practice, and it's called Gulfstream Park. And it's racing all year round, and the most famous jockeys in the whole country come to race there from about December through April. And I have a satellite center where we go every single week to go assess and treat the jockeys with chiropractic, which is amazing because they come in the beginning of the season with any number of aches and pains, and halfway through the season, after I've had an opportunity to check them on a weekly basis, they live not only pain-free, but optimized and feeling well. So it's a little different working with an athlete in that we're not just focusing on pain, but also improving their performance.
How interesting. And so you actually have office hours on site at the racetrack?
Yes.
So what are some of the unique, if any, injuries that you run into with jockeys?
So with jockeys, there's two types of injuries. Unfortunately, it is a potentially very dangerous sport. In fact, it's the only sport that has an ambulance following them around as they're competing. Yeah. So unfortunately, if it's a fall, they typically have to go to the hospital to be checked for fractures or something more serious. But after they're cleared and they're potentially still in pain, I see severe sprain strains, fixated joints, concussions, and then the thing that really robs most people from quality of life, and in their case, their ability to perform well, is head-to-toe aches and pains and wear and tear of extreme pressure and trauma on the body over a very long period of time.
Do they have a higher incidence of back pain with all the pounding they do?
You know, I don't think so.
Yeah.
You know, my most active patients, and this includes pro athletes, probably have the least pain of anybody that I know. I would say the people who have the most pain are sedentary.
Yeah. And given that riding demands that you have very strong thighs to post,
yes,
do they tend to have leg injuries in their leg muscles, the thigh muscles, the quadriceps, the hamstrings?
Sure. That's a very interesting question. So most people don't know that jockeys ride with one stirrup short as they're always going counterclockwise around the track. And so I do tend to find one-sided hip or low back pain. So instead of just doing arbitrary massage and, just working on one area that seems extra tight, I tend to do a lot of sacroiliac work and work around the sacrum to help stabilize and even out their pelvis with a practice that's just common to everybody who rides racehorses.
Okay. So let's shift gears to another professional athlete, professional football players and basketball players. you deal with them as well. In what setting? Explain to our viewers.
So when I first started out 8 years ago, I worked field side at an NFL combine training facility. And so I was treating players literally field side, or they would come into the office, and it was either for pain or to check them preemptively to help optimize performance.
And many of these pro players are 300, 350 pounds. What are your challenges providing adjustment therapy for somebody who is so big?
Right, so if it's an NFL player, they obviously carry a lot more mass. And if it's an NBA player, because I do a lot of the basketball camps in Miami, I really don't find it.
Basketball camps for adults.
Basketball camps for adults. That's
yeah.
for Dwayne Wade and the University of Miami. So basketball camps for adults.
Right.
I really do not struggle with adjusting the spine of somebody who's dramatically bigger than me, 350 pounds and 6'7", because what I was taught when I matriculated to chiropractic school is that when we apply a force to treat somebody, force equals mass times acceleration. And so because I don't have a lot of mass, I have to have a lot of acceleration.
Okay.
So my technique is well placed and extremely quick. And so I'm able to apply an adjustment to anyone of any size and be extremely effective.
And similarly with basketball players who are so much taller than you, do you have any challenges? For example, are they too long for your table or anything like that?
So even last year, my office was hired to do the Shaquille O'Neal basketball camp, and he's, I don't know how tall, 6'7" and 300.
No, he's about 7'2".
He's 7, right?
Yeah.
And we adjusted him with no problem. So the answer is no. If you have the right equipment, a long enough table that can support an athlete of that size. It was even last year, I don't even remember the stuff because this is just commonplace, is to treat athletes literally of all sizes at my practice.
What about children? Are children candidates for chiropractic?
Yes. I love treating children, as do most chiropractors. When children go through the birth process, which can also be called birth trauma, and also later on in their developmental time when they're learning how to walk and they're taking falls, whether it's tripping or off a bicycle, children, you notice developmental issues in children, and it doesn't have to be dramatic. So when it comes to treating children, it is for less common items that you would see in a chiropractic office, not neck pain, not back pain. Children typically come to see a chiropractor for earaches, constipation, asthma, poor sleep, not breastfeeding equally from side to side. And what I love about treating children is there is no placebo effect. The results are immediate. It is extremely safe to treat children. When you're treating a baby, you're talking about fingertip type pressure on the cranium or spine.
Sure.
And so even for my child, when you think about improving the relationship with how the brain communicates with the rest of the body through the spine, you want to be able to improve immunity and decrease stress on the nervous system in a developing child. And my child is 17 months old, as an example, and just had her first cold. And this is a baby who has been coming to my office since she's 5 weeks old and has access to every sick person on the planet. And this is a child with a healthy, strong immune system. So babies usually see chiropractors not for typical musculoskeletal pain, but for more improvement of development and health.
Very good. Well, this interview has flown by. Thank you for joining us on Housecall. If our viewers have any questions, how can they reach you?
So they can visit my website, which is www.drdoman.com. That's drdoman.com. Or they can send me an email to info@drdoman.com.
Thanks for joining us on Housecall, and I'm a very proud father.
Thank you.
My thanks to my guest, Dr. Sandy Doman. My thanks to my terrific team here at the studio. And most important, thanks to you, the viewer. Thanks for welcoming us into your home. Let us know how we're doing. You can reach me at my practice website, montgomerygastro.com. As for our next show, we're going to have 2 licensed nutritionists discussing weight reduction regimens, gluten-free diets, and many other exciting nutrition topics. It's going to be a terrific show. See you then next time for another edition of Housecall. Good evening.